Hello everyone, my name is Ruth Ko and today I'll be talking about two procedures that are commonly used for decreasing or eliminating problem behaviors: differential reinforcement of other behavior and differential reinforcement of alternative behavior. First, let's talk about differential reinforcement. That is the ABA principle in which these two procedures have been developed from. It involves reinforcing certain responses and placing all other responses within the same response class on extinction. As a result, the responses that are reinforced become more likely to occur in the future, and those responses that are placed on extinction are weakened or eliminated. In regards to DRA, reinforcement is provided contingent on an alternative response, and the target behavior is placed on extinction. Usually, the alternative response is more socially appropriate compared to the target behavior. For example, in Dixon, Benedict, and Larson's 2001 study, a DRA intervention was found effective in reducing the inappropriate verbal behavior of an adult man. Contingent reinforcement was provided for appropriate verbal responses, and the target behavior no longer produced reinforcement. In a DRO procedure, reinforcement is provided at the end of the time interval contingent on the absence of the target behavior. If the target behavior occurs, the time interval is reset and reinforcement is delayed. For example, in Daddario, Arnold, and Barton's 2007 study, they found a DRO intervention was effective in reducing the disruptive behavior of 7 typically developing children in a preschool setting. There has been extensive research on both of these procedures that support their effectiveness. DRA has effectively reduced aggression, destruction, food rejection, and more. For DRO, research shows that it can reduce disruptive behaviors, stereotypy, nail biting, mouthing, and more. In Fletcher, Ray, and Bailey's 2009 study, 116 empirical studies that utilized DRA were examined, and DRA with and without extinction were considered a well-established treatment according to the division's criteria. That's really good. These interventions are also highly preferred and used often because they use reinforcement rather than punishment. Specific to DRA, they also teach socially significant behaviors that allow reinforcer access in an appropriate way. Before implementing these two interventions, a functional behavioral assessment should be conducted to determine the function of the problem behavior. With the function determined, an appropriate intervention strategy can be implemented. For DRA, the function of the problem behavior can aid in selecting an appropriate alternative behavior that accesses the same functional reinforcer. For DRO, the reinforcer delivered can be functionally matched. Research shows that these interventions are more effective than those with arbitrary reinforcers. Data should be collected regarding the problem behavior and the alternative response in the case of DRA. Data should be collected at baseline and intervention to see its influence on the target and alternative behaviors. For DRO, data regarding the inter-response time between each occurrence of the problem behavior should be taken to determine the starting interval for the DRO procedure. The starting interval should be short enough to allow contact with the reinforcer. Other assessments include evaluating the response effort of the problem behavior and the alternative behavior. For DRO, assessing the resources available for the person implementing the procedures may be useful because these procedures are labor-intensive and require resources. DRA is recommended if it is important to teach and strengthen an alternative behavior. In Hagopian, Wilson, and Wilder's 2001 study, the DRA with NCR procedure was effective at reducing the aggressive behavior of a boy with autism, and it also increased the verbal requests as an appropriate alternative behavior. For DRO, you don't need to teach a skill. This has made DRO a frequently used intervention for reducing behaviors that have an automatic function. In Hefferman and Lyon's 2016 study, a DRO procedure reduced severe nail biting maintained by automatic function to near 0 levels. However, there are some conditions in which some considerations need to be made. For example, behaviors that can cause harm to the client and the people around them can pose an extra challenge because of the time required to teach and shape the alternative response. For DRO, a limitation is that there is no teaching of an alternative behavior. Therefore, an individual may engage in other behaviors to access the reinforcer. Another limitation may be the requirement of additional components. In Cal et al.'s 2011 study, DRO without blocking was less effective in reducing elopement compared to DRO with blocking. In conclusion, even though there are some limitations, there has also been much research on modifications to these interventions to address the limitations. Overall, these two procedures have strong empirical support for their effectiveness in reducing problem behaviors.